perhaps more part of the public discussion since you've teamed up with Trump is to make public health a political issue. And so you talked about the public health crisis, and maybe you could lay out the dimensions of that crisis. I mean, I know there's an obesity epidemic, there's a diabetes epidemic. These are very, very serious problems. And so, but you've concentrated on that in a way that just isn't characteristic of anybody on the political landscape at all. And now it's become an issue that's front and center. And so I'd like to hear more about your thoughts, why you think that's such a fundamental priority, compared to, say, free speech and war and peace. Why health? And what you see, lay out the landscape of the problem and also the landscape of potential solution.
Yeah, so we are now the sickest country in the world. We have the highest chronic disease burden in the world. When my uncle was president, I was a 10-year-old boy. About 6% of Americans had chronic illness, and today 60%. When my uncle was president, we spent zero in this country on chronic disease, zero. And today, and for many chronic diseases, first of all, there weren't even diagnoses and there weren't drugs available. Today, we spend $4.3 trillion, so about 95% of our health budget. It's the biggest, and it's 5 times our military cost. It's the biggest item in our budget, and it is the fastest growing. And not only that, so it's destroying our country economically, absolutely debilitating it. All of our other issues are small towards it. If you just measure its economic impact, it has other impacts. 77% of American children are no longer eligible for the military because of chronic disease.
And is that obesity related with kids?
Obesity is one of them. Obesity when my uncle was president was 3.4%. Today it's 74%.
And what do you think is driving the obesity epidemic? It's such a transformation.
Yeah, I mean, it's being driven by poison food, by ultra processed wheat, sugar, and flour, seed oils, soy, canola, sunflower flour, and then wheat and corn, which are all heavily subsidized. So those 90% of farm subsidies, the crop insurance, et cetera, go to those 3 categories of soy, corn, and wheat. And those are the feedstocks for all of our processed foods. They turn into sugar. They're all nutrient barren. The original crops were nutrient rich, but the GMO crops are nutrient barren, and they're heavily dependent on pesticides. The reason GMOs are so popular is because they're resistant to pests. The reason they're resistant to pests is because they are resistant to pesticides like glyphosate. So you can saturate the whole landscape with glyphosate from airplanes, and then the only thing that's green is GMO corn, which is Roundup Ready. It's called Roundup resistant corn, and because of that, it's also very heavily laden with pesticides. Wheat, glyphosate is also used as a desiccant, which means it dries out wheat, so it's sprayed on the wheat right at harvest, which means it's going right into the food. And when that began in 1993, that's when you saw all the appearance of all these gluten allergies and celiac disease and wheat allergies that you don't have in Europe. You can eat spaghetti here, and you're going to get eczema and all of these stomach complaints. And then you go to Italy and you eat it, and you get thin. But here, and then the corn is turned into high fructose corn syrup, which is just a formula for making you obese and diabetic. And Americans, diabetes is one of the diseases. When I was a kid, the average pediatrician saw 1 case of diabetes in his lifetime. So a 40 or 50 year career, he may see 1 case of juvenile diabetes. Today, 1 out of every 3 kids who walks through his office door is diabetic or pre-diabetic. And we spend more on diabetes than our military budget. So that is, and nobody's talking about this.
Yeah, right.
And these are all of these autoimmune disease, diabetes, autoimmune disease, Alzheimer's is a form of diabetes. It's type 3 diabetes. It comes from poison food.
So is it how much of it do you think is the toxin load per se? And how much of it do you think is carbohydrate?
It's the overload of sugars, because all of those grains turn into sucrose, and they're very low in nutrients. So we're malnourishing kids. You're seeing high levels of obesity, and in the same people who have high levels of obesity, there's also high levels of malnutrition. The most malnourished people in this country are the most overweight, right? Because they're eating food like substances.
Yeah,
and then
that's a good phrase.
And then they're covered with chemicals and pesticides. Plus, some of those are part of the food processing, but some of them are pesticides, etc. There's 1,000 ingredients in our food that are illegal in Europe and other countries. So we're just mass poisoning us, and nobody has a chronic disease epidemic like we do in our country. That's why one of the reasons we had the highest death rate from COVID. We had 16% of the COVID deaths in this country. We only have 4.2% of the world's population. And so we did worse than any other country. And the CDC explains that, says it's not our fault. It's because Americans are so sick. CDC said the average American who died from COVID had 3.8 chronic diseases.
Right.
So it wasn't COVID, it was killing them. It was chronic disease, right? And we have the sickest, we have the highest chronic disease burden, we have the highest COVID death rate. But it's not just, it's those autoimmune diseases like rheumatoid arthritis, juvenile diabetes, lupus, Crohn's disease, all this IBS. All of these things had suddenly appeared in the mid-'80s. I never knew anybody with any of those diseases when I was a kid.
Yeah, right.
The neurological diseases, ADD, ADHD, speech delay, language delay, tics, Tourette syndrome, narcolepsy, sleep disorders, Tourette syndrome, ASD, autism rates In my generation, 70-year-old men is about between 1 in 1,500 and 1 in 10,000. That's what it is today. My children's generation is 1 in every 34 kids, according to CDC, 1 in every 22 in California. So, and it is devastating. Our generation, our economy. It's going to cause autism alone. So there's a recent paper by Mark Blaxell that shows it'll cost $1 trillion a year by 2030. And then the allergic disease again, which I never saw as a kid. I had 11 siblings, 70 first cousins. I never knew anybody with a peanut allergy. Why do my 7 kids have allergies? It's
So you're up against some major forces in fighting that particular battle. I mean, first of all, you have to sway public opinion in that direction, and then there's going to be a massive force arrayed against any possible interventions. That's for sure. So, tell me what you think you could do, and also tell me why you don't think you would be stopped.
Well, I think they're going to try to stop us, but I've been thinking about this for 40 years, so I know how to do it. And I've worked with Mark Hyman and Kelly Means and Casey Means and a lot of other people to figure out how to do it without having to go to Congress, to do it all with executive orders and policy changes. And, I'll give you one example. I mean, you can get fluoride out of the water by executive order, out of the water systems all over the country. And that is, that's a big issue with public health and cancer, et cetera. But there are other things like it would be very hard. You'd never get congressional approval to ban glyphosate, which is causing all kinds of health problems and cancers all over this country. And so, but here's what you can do. NIH has a budget of $42 billion a year, and it distributes that money to 56,000 scientists who are at research centers, mainly universities in North America, Canada, the United States, and some in Europe. And they're supposed to be doing basic science, but what they really do nowadays is they do drug development for the pharmaceutical industry. So NIH is now the primary incubator for new pharmaceutical drugs. And it changed that rule, that changed. NIH used to be the primary scientific agency in the world. That changed in 1980 because we passed a bill called the Bayh-Dole Act that allowed NIH itself and NIH scientists to collect royalties on any pharmaceutical product that they developed. So now that they follow the money, and now what NIH does is they're in a partnership with pharma. They develop new products to treat chronic disease, and anybody who tries to study the etiology, the origins, the causes of chronic disease, that scientist will be blackballed forever. And so what I'm going to do, is change NIH and say we're going to make the primary purpose of this agency to develop science on what's causing chronic disease. So right now, there's very little science that says high fructose corn syrup causes diabetes. That's deliberate. We don't have that science because the agency does not want to see that science. I'm going to make sure that science happens. Not one study, but not just 20 studies, but 100 studies that show that. Now, what happens when you have 100 studies? There is a rule in the federal courts in this country called the Daubert Rule. And that says that if you believe you got sickened by a product, like say you think Coca-Cola made you obese, you can't sue Coca-Cola unless there's at least a critical mass of studies, maybe 20 or 30, that say that that's what it does.
So it's a liability enhancer.
Well, the judge has to make that decision about whether you've passed the Daubert threshold before he allows you to go to a jury. So in a big case, like when I tried the Monsanto case, I was part of the trial team. The big threshold is, can you pass Daubert? And we had about 20 studies that showed that Monsanto, that Roundup caused non-Hodgkin's lymphoma. And we had mouse studies, we had rat studies, we had animal studies, bench studies, observational studies, epidemiological studies, so a good range of all different kinds of studies that show that once you get that critical mass, then you can go to a jury. And once that happens, the product is through. So when we sued Roundup, we had 40,000 home gardeners who had gotten non-Hodgkin's lymphoma from using Roundup in their backyards. And the way that you try multi-district litigation, you try one of those cases at a time, right, one after the other in rapid fire, till somebody says, uncle. You either lose them all, and then you run out of money because it costs a lot of money to try a case, or you win them all, and the maker of that product then has to come to the negotiating table and settle it. We won $289 million in the first trial. We won $89 million in the second. The third trial, we asked for $1 billion, and we got $2.2 billion from the jury. And then Monsanto came to the negotiating table, and we settled the cases for $13 billion, and they agreed to take Roundup, to take glyphosate out of home gardening products. Mm-hmm. Well, that's what you do.
Got it.
Once enough science is out there, you don't have to legislate against high fructose corn syrup. The lawyers are going to come out of the woodwork, and they're going to be representing 1 million kids with diabetes, and the company is going to say, we're not going to make this product anymore.